Our first series welcomes topic experts using the ISPA 8 investments to frame the conversation, showcasing Scotland's whole systems approach through a long-term health condition lens.
Hello and welcome to today's Movement for Health podcast, Movement in Conversation. This is part of our series 1, looking at Scotland's systems-based approach and the 8 investments at work. This episode is active health and social care, and who better to be our guest today than Scotland's Chief Medical Officer, Professor Sir Gregor Smith. Gregor, welcome and hello.
Hi, well, thank you so much for the invite to come and speak to you today.
Thank you for coming and speaking to us. We very appreciate it. For context then, so today's conversation, we're going to look at the active health and social care and its role in supporting people to move more in ways that suit them, specifically people living with long-term health conditions, their symptoms, their circumstances. Being able to be physically active, as we know, is just part of the puzzle when looking to address Scotland's health inequalities. And we're at a time when many reports and work programmes are aligning, which is wonderful to see, to address the health inequalities of the country and improve health outcomes for those in the poorest parts of Scotland. And in August of this year, your CMO report, Realistic Medicine, Taking Care, People, Planet, Progress, Purpose, goes into detail about the need to continue to prioritise how to tackle existing inequalities and look at the root causes of the issues, going as far as specifically mentioning the impact of sedentary lifestyles on worsening health outcomes for many. So thinking about this report, as well as the latest burden of disease report from Public Health Scotland, your CMO physical activity guidelines, how is Scotland's health and social care playing their part in supporting people to be active? So we've got some questions to go through, and please take your time. We look forward to hearing from you. So if we start at the report and how I see it's being laid out into 4 key priority areas that when working together, will see the biggest benefits for the health of Scotland's population. Can we start by taking a little bit of time to talk through the biggest challenges that our population faces today?
Well, thank you. And thank you for mentioning my report. The research reports are published on an annual basis, and what I attempt to do with them is to try to send a message, convey a message both to my colleagues across the care systems in Scotland, but also to convey a message to the public as well. And I think that that ability to be able to face both audience and speak the same language to both audience is really, really important at this time. And you're right, I've identified 4 major population health challenges that Scotland faces now and in the years to come. And I don't think any of these will come as a surprise to people, but if we try to articulate what they are and then make the links between them, I think that's the important aspect. So the first is the ongoing threat that we have with infectious disease, and everyone has become familiar with the problems that we've faced over recent years with infectious disease through the COVID-19. It goes beyond that, doesn't it? Because we've continually faced infectious disease right through history. And every year we know that flu season is going to arrive upon us, and at other times of the year there'll be other types of infection that we see a lot of. And maybe we take for granted sometimes actually just how far antibiotics and vaccinations have taken us as a population, how much protection that they give us. So making sure that we make the most of the protective nature of vaccinations, but also preserving the usefulness of antibiotics for the future, and a huge challenge for us to make sure that we're ready for the ongoing threat of infectious disease. The second problem that we face is one of improving both life expectancy, but also healthy life expectancy in our population. And I distinguish the 2 aspects of that there, because I think equally they're both important. Decades we've seen life expectancy improve in a fairly consistent trajectory. Below that, if you like, healthy life expectancy makes similar leaps and bounds over that time as well. But gradually, over time, what we see happening is that the gap begins to widen, and people live with longer term conditions or chronic disease for longer periods of their life. And that's something we've got to address. Now, around about 2012, in this country, began to become particularly concerned that the rate of improvement that we were seeing in life expectancy was beginning to slow down. And in some of our communities, it's actually started to reverse now. So that we see both healthy life expectancy and life expectancy not showing the same type of improvement that we were seeing in the past. So what does that mean? Bottom line is, health inequalities in our country are actually getting wider, and they're too wide between the most affluent and our most disadvantaged communities, or people with particular characteristics. We've got to address that as a health crisis, and we've got to prevent people living with chronic disease for long periods of their life. One of the aspects that's really important is to be able to maintain people in good health so that they can contribute both to their family life, to their work life, and also to society for longer periods as well. The third big challenge that we face is in the face of all that, in the face of increasing rate of, well, I call them non-communicable disease, but other people might know them as diseases like heart disease, like lung disease, such as asthma, or chronic obstructive pulmonary disease like diabetes. There's many, many of them. But in the face of increasing rates of chronic disease like that, how do we create a sustainable health and care system for the future? Because the amount of money that we've got to spend is not increasing hugely or vastly every year as well. And actually, to keep up with that demand and keep up with the new technologies that are available as well, that becomes an almost unsustainable way of looking at things. And we've got to acknowledge as well that actually there's a lot of what we do within the healthcare system as well doesn't meaningfully improve people's health. The OECD reckons that about 20% of all spend in health and care, or in healthcare, is not meaningfully improving people's lives. So how do we identify that type of care and provide higher value care to people, particularly when you begin to look at studies like the Scottish Burden of Disease study produced by Public Health Scotland, which estimates that over now to 2043, we're likely to see a 21% increase in the overall burden of disease that the Scottish population will experience. And that's at a time when actually the Scottish population falls in numbers. So you can see that there's something has got to change in the way that we do things. One of the ways that we can do that is to get much more strongly into preventing disease, preventing these non-communicable diseases from developing in the first place. And we're going to speak about that over the course of the rest of this interview, I suspect, and what role physical activity has to play in that. Now, the fourth challenge is perhaps the biggest challenge of all, Emma, in my view. The fourth challenge is the challenge posed to human health by planetary health and the planetary health crisis. And when I talk about the planetary health crisis, I'm not just talking about the greenhouse gases that cause some of the effects of climate change that we see, but actually it's the effect of climate change alongside the loss of biodiversity, alongside increasing air pollution and the impacts that that has on human health, which are huge and varied. And some people think of that as a threat that might exist in the future, but actually that threat is having an impact on people's health here and now, not just in other countries globally, but actually in our own country. Now, whether that be the changing patterns of vector-borne disease, whether that be changing patterns of the way that we experience extremes of weather, particularly, although it might seem strange to say it in the UK, but the effects of long periods of particularly hot weather, all of these contribute to changes in the outcomes that we experience from health as well. Food insecurity, water insecurity, changing patterns of migrants, travel, who are escaping some of the impacts of the climate change in their own countries. All of these are impacts that we need to think about how we respond to in our country for the future. Now, these four challenges that I've outlined, completely interlinked. It's impossible to separate them. And that's the important message here, is that the impacts of climate change will be felt much more severely by those who already experience health inequalities. The impacts of climate change also make a much more unstable environment for the way that we experience new and emerging infectious disease. And all these health impacts, whether it be through infectious disease, whether it be through the rise in non-communicable disease, all impacting the sustainability of our healthcare services as well. That's why those four challenges that we have must be seen together. And the only way that we can address them is to look at how we can tackle them all using a single unified approach. Physical activity actually physical activity is one of those examples that falls into those categories that can help us.
You're absolutely right. Absolutely right. And I'm so glad that you said that. That leads us on really, really nicely to look at the whole systems approach, which obviously Active Scotland's physical activity for health framework that's newly launched really shows, and how that can be broken down into those 8 thematic areas that need to be working together and across systems. So intersectionality needs to be at the front and center of when we're planning these things, how we're going to combat these things that are coming at us now and in the future. Just picking back up then on the health inequalities, and actually it cuts across all of them. It cuts across all 4. So people living with long-term health conditions, just over a third of the adult population in Scotland currently, a lot of whom have the NCDs, the non-communicable diseases that you touched upon there. So a lot of those people will be facing inequalities and challenges for various reasons. And if they, for example, could be at higher risk of the infectious diseases that you talked about, they are also more likely to have other long-term health conditions because they have a long-term health condition. They also might potentially be impacted most by climate change as well. How about looking at physical activity as one of those cross-cutting threads, that golden thread that I think has been looked at as it's a nice to have, it's a nice to do, it's potentially for the privileged, it's for those of us that already can. I really want to know how we can change the narrative around this. I don't know if you have that answer right now, but when we look at part of those themes that we've been identifying, active health and social care is one of them. It's a crucial one. Speaking for people obviously living with long-term health conditions, they will be in and out of different care environments at different times of their lives as and when they need it. A lot of them will be in the community as well as in hospital settings. What role does active health and social care have to support people with long-term health conditions to be able to move more? And why is it important? But what are also the challenges? I guess there's several questions in one.
Oh, there's lots to unpick there.
Yeah.
And let's just start by saying, the very fact that we're having this conversation is the very good starting point. Because the more that we have this conversation about what physical activity can offer in terms of improving health, now improving health both in terms of longer term prevention, so what we would call primary prevention, looking at a population-based approach to how we prevent disease, but also in assisting people who perhaps have already developed chronic conditions in some way, but are maximising the health benefit that they have from activity, from interventions like physical activity. And, when we're talking about physical activity, Emma, it's really important that we put it in context, isn't it? We're not talking about donning the lycra and going on a bike or getting to the gym, and that's the only form of physical activity that people can take. Physical activity is about moving. Physical activity is about making sure that we are doing what we can within our sphere of control and ability to be able to keep ourselves active. And perhaps one of the obstacles that you spoke about for that is perhaps removing the barriers why people feel intimidated by the thought of physical activity. Because physical activity doesn't have to be about going to the gym. Sure, if you're able to and you enjoy it, go to the gym. I get a huge amount out of doing that. But actually, it doesn't have to be about that. It can be something as simple as a pastime like gardening. It can be going for a walk. It can be enjoying the outdoors. It can be catching up with friends, and rather than sitting in a cafe, having a coffee with them, go for a walk with a drink with them. It's simple things which make a difference, and everyone has different levels of capability in relation to physical activity, but what you can do is important. And I think that's one of the most important messages that I can get across, is that it doesn't have to be. If we begin to have a conversation with people in those terms, well, just think about it. What we can begin to do is we can begin to encourage people to take personal action to improve their own health. Now, about 1 in 100 life years lost in Scotland is down to physical inactivity. There are 3,000 deaths a year in Scotland which are attributable to being physically inactive. We use 11,000 disability adjusted light years, which is a measurement we use to try to get a sense of illness burden, but 11,000 disability adjusted life years lost in Scotland due to physical inactivity alone. And if we begin to make a difference, if we can begin to encourage as health professionals to just get people up and moving more, then that for me is something which is a huge benefit. And then the other benefit of it is, well, it begins to put you into contact with other people, because particularly with some forms of physical activity, it might be that you're joining a walking club. It might be that you're joining some sort of other exercise which is done in a group, and you're meeting people and you're reducing some of the loneliness that some people experience, that you are building other skills as well when you're with them, that you're enjoying the outdoors. A lot of people don't realise this, but actually the evidence is really compelling that even just being in a green space in Scotland, anywhere, but I say Scotland because we're so beautiful, but even being in a green space actually begins to improve both your physical health, your mental health, improves your soul well-being. And there's some beginning emerging evidence coming through that, particularly for younger people, improves the cognitive abilities as well. So, exercising, moving is good. Exercising or moving in a green space is even better. So anything that we can do to try to encourage that actually helps us to create a much more sustainable health and care service as well, because it's alternative sometimes to when medicines are not needed, but actually we need to promote health instead. So it's kind of not only to the sustainability of the health service, but also it's kind of to the planet as well, because generally if we're not utilising those type of resources, we're not having an impact on particularly the carbon footprint that we leave on planetary health as well. So for me, that's a win-win. Exercising green space has to be something which we see and value. And in Scotland, we've got 4 green health partnerships just now, which have already been exploring the evidence between improving health outcomes, people's experience of health, and being in that green outdoor space, and particularly taking physical activity when you're in that space as well. And I am really attracted to that model. I am really attracted and encouraged by some of the results that we're already starting to see in that space. And the more that we encourage that as health professionals, the better. But you spoke about the obstacles. What's the obstacles? Well, sometimes it can just be perceptions that people have of exercise, as I've already spoken about. Exercise doesn't have to be about having all the kit and going to the gym. Sometimes it's just about actually finding like-minded people that you can do something with, and that you can go and enjoy some company with, or whilst you're doing that you're moving, and whether it's wheeling, whether it's walking, whether it's gardening, whatever your chosen activity is, doing it with others especially gives something additional in my view. And it gives you that kind of peer support as well. One of the things I've been attracted to recently, and I wish I could do it myself, but dance classes and the impact that dance classes have at any stage of your life, but particularly as you're getting older. The way that it exercises almost every muscle in your body, the way that it actually improves both your balance, but also your strength. And it's a social activity as well. All of these things working together can't help but improve people's health. So again, recognising as health professionals that this is something which has a positive impact on people's health, recognising that there are many, many ways in which we can enjoy it, but knowing where to refer people or signpost people to, that's the key for me. That's the key. Debunk some of the problems that we have in identifying what are legitimate or credible pathways of signposting for this. Give people the ability to be able to know what's going on in their local areas. Create that sense of community, and that's how you remove some of the barriers to this.
And I think there's a lot there that I've heard in conversations with practitioners around accessing local needs, meeting people where they're at, understanding the human and their needs as an individual. And I know that obviously social prescribers are incredible in this role, and that link worker role into the community, which is so vital. So it's really good to hear that is something that is a really important piece of the puzzle, definitely. I also wonder about the other opportunities or nudges that we could be thinking about for people. I know that there's a really lovely program. There's lots of lovely programs. There's a lovely program, Active Wards in Glasgow, which is Dr. Juliet Harvey, physiotherapist, and gets a huge group of occupational therapists, other physiotherapists together, and they've created this Active Wards program. And that is taking the environment itself in a hospital setting, what would be a very traditional type of hospital building, potentially not fit for helping people to move before and after interventions when they've been in care. But obviously we know that specifically for older adults as well, losing that muscle puts you at much higher risks of your falls and things. So that strength and balance, which Active Wards is very much promoting, at these sort of dispersed exercise panels along the wards that people can join in on. They sort of refer to that as part of their recovery, and that narrative all of a sudden looks quite different, for, where we were, no rest, put your feet up. We know that getting moving quickly is incredibly important after intervention too, but it's done in a safe space. You're being given permission as well. And I think that so many people living with long-term health conditions, potentially those that have been living with them a very long time, that risk aversion and potentially not understanding the risk versus benefit associated with moving more, and perhaps not always getting that from their different healthcare providers either, I think has potentially meant more shielding, all the weather's changing, I don't want to go out because it's icy, that kind of thing as well. So I think there is something around this nudge theory, this also a sort of an advocacy for and leadership in. Speaking with some general practitioners quite recently, they're talking about how they're trying to change their waiting rooms and areas to show beautiful pictures of local green spaces, and trying to have conversations with their patients about, did you know that's just up the road, sort of thing. Maybe we'll have a walk there. I know that some surgeries are hosting weekly health walks from the surgery as well. So something to me about that cultural shift in that narrative. And I'm really pleased that you said about don't have to don the lycra. Think of nothing worse, frankly. That's for me personally, but so much of this for people living with long-term chronic pain conditions, chronic fatigue conditions, that the word exercise is just not conducive to any form of movement for many people. Neither is physical activity for many people, but movement is so much more inclusive and accessible. And I think picking up on your point of all movement is valuable, what you can do matters. And I think we could do more with that narrative, because I'm not quite sure we've got there yet.
I agree with you. I mean, I think so. And even I've been on a journey with that. I've got to say, because if you'd spoken to me 10 years ago, I would probably have been one of those advocates for it's all about exercise, and I guess over time, as I've understood more and more about people's experience of movement, and particularly what it brings to them, it makes you. It gives you a wonderful insight actually into what matters. What matters. Now, if we go back to the principles of realistic medicine, which is a body of work which I'm very proud to be associated with, but it's about actually understanding it from people's perspective and personalising care towards their particular preferences. I think this is where the movement debate really becomes important, because we all have different abilities. We all have different preconceptions or abilities to be able to bring towards physical activity and movement. And I would love to be an elite athlete. I am never going to be an elite athlete now. And over the years, I've watched my exercise performance change, and that's normal, because that's what happens to people as they grow older, as different demands come in their life and so forth. And I've adapted, and I've got used to that. And adaptation is something which I think is really, really important. And for people to understand that actually, when we talk about physical activity or movement, we're not encouraging people to go and buy a bike. We're not encouraging people to buy a gym membership. If you can, if that's where you want to do it, then great, go and do it. But that's certainly not what I'm talking about. Because actually, movement is one of the most inclusive things that we can do if it's done carefully and properly, and sensitive to what people's ability levels are. And so when we think about movement, particularly in the context of chronic disease, we need to remember that for some people, movement is incredibly difficult. Now, whether that's because you carry chronic pain with you on a daily basis, whether it's because you've got one of the many fatigue syndromes, which impacts on the way that you're able to live your life, or whether you have other disabilities that you carry with you, either physical or, they could be related to lung disease or heart disease or neurological disease of one form or another. It all means that you've got to be able to taper and temper movement according to your needs, and they might be different on different days, and acknowledge that they might be different at different times. And sometimes you'll be going through a good day or a good week, and you might find that you're able to do a little more, and other times you might find that you just can't do as much and you get frustrated. Don't be frustrated if you can't. Try and not get frustrated by it, but just do what you can just to do and keep yourself moving. And you mentioned something that was really important. You mentioned this: as we get older, as we become more inactive, perhaps, as we sometimes lose confidence or are impacted more by the physical illness that we carry with us, sometimes we find that we don't move as much. Hospital stays are terribly bad for that if we're not careful. But also periods at home when we're not feeling so good as well, or maybe the things like the weather outside just makes us a little bit more nervous about going out. Movement during those times are really, really important, because as we get older, obviously we decondition so much more quickly. And then, again, I think this is really important. I think it's understood now by healthcare professionals that actually that type of inactivity is unsafe and it's harmful. And actually sometimes one of the worst places for a person to be is in a hospital bed. And I think how we convey that message to the wider public, that this whole concept of what we call deconditioning, is really, really important, so that people understand that actually as you get older, you lose muscle mass really quickly. And that impacts your balance, and that impacts your ability to be able to move and to be independent. And if we lose independence, and if we become more dependent on others, then we lose so much of our lives and our self-identity as well. And that's a psychological blow to us as well that is hard to recover from too. So actually preserving movement through, and it might be the most gentle forms of physical activity, has a huge, huge benefit in delaying that dependency in later life as well. And I think that for me is one of the most important goals that we can try to set ourselves with movement.
I think that's a really interesting point about how do we communicate that wider, I guess. So something came to my mind then when you were speaking, that I used to work on a dementia project at Pass for All, and we were working with care homes and care home settings specifically for people living with dementia. It was an absolute joy, privilege of a project. But one of the biggest challenges I found was, and again, this kind of mirrors the active wards, it was looking at the environment of the home and seeing how we could promote more movement on a daily basis, because over 90% of residents' daytime hours are spent sitting in a chair normally. So we're trying to address that culture as well, and that risk aversity in terms of they move, they fall. If they don't move, they will definitely fall if they try to. So, but actually one of the biggest barriers we had was family members who we invited along to learn about the project. And they're very much, why are you doing this to my granny, my mum, my what have you? She's earned a rest. Let her rest. And it is that sort of quite different cultural approach that we have in terms of aging. So it's something certainly to think about, getting that wider message across to people. I think it's really important.
So the whole concept for the future has to be about how do we age healthily?
Yeah, it's not about aging.
How do we age well? Exactly. How do we age well? How do we make sure that as a population we're looking at the whole life course that we experience, and that we're doing things early enough in our life course that are going to make a bigger difference later on in life? And, there's different ways that we can approach that. One of the things I get really worried about, maybe some signs of improvement, although maybe not so much at times, but actually is particularly for young women. how many of them move away from exercise or movement at a younger age, and the effects that that then has on their overall health, often specifically on their bone density or on their muscle mass as they go into the kind of later years. So for me, there's something about thinking early as possible, making movement part of your everyday life, as we've already said, whatever that may be, trying to encourage as many people at a younger age to take formal exercise as possible. We've got the CMO guidelines. They're there for a reason, because they're evidence-based and they promote a level of activity that we know is beneficial to health, not just at that point in time, but especially if you carry on through life.
Okay.
That we're making a particular emphasis for the future on resistance training. I think it's something that's often overlooked. And, we always think about movement and exercise, particularly at younger ages, as something that gets your heart rate right up and
something quite athletic.
Yeah. And actually, resistance training of one sort or another can have huge benefits on your health as well, and benefits that are long lasting through life as well. So how we use resistance training and promote resistance training in a more structured way as well for the future. And as I say, starting at those younger ages, but establishing for me the habit of movement and exercise as part of your routine in life, something that you use not just for your physical well-being, but actually for your mental health and well-being as well, and that you carry on with that through life. And the forms of exercise, as you say, might adapt as you go through life, and some of it might even be fun.
Never know. But
the walking groups where you're able to kind of be amongst other people, the dance classes where you're able to enjoy the experience of dance as well. These are things that we've got to start building into our concept of physical activity.
So I have a question then about prevention. Obviously, movement, physical activity, what we're talking about is a very powerful prevention tool for many of the challenges that we know the population faces now and in the future. Tricky question then, I guess, is how do we move to see much more of our spend in a preventative way when there's so much acute need? How do we make that shift? How do we make that a priority? Obviously, it's a slow thing to turn that ship, but how can we see that move?
So let's use the evidence as the first thing when we're considering where we spend our money to biggest impact to improve health. I think that's always got to be the starting point. And towards the beginning of the interview, one of the things I mentioned was the Scottish Burden of Disease study. To recap, it suggests that there's going to be around a 21% increase in overall burden of disease experienced by the Scottish population up to the point of 2043.
Mm-hmm.
We can't use a healthcare model to address that. We cannot use the recovery shop to help people with that. What we need to do is to get into prevention, and it's all forms of prevention. Now, when I think about primary prevention, I think about how you take all population approaches that are going to help and improve people's health, whether that be through specific preventive programs of work, or particularly about actually how you just overall look at improving some of the fundamental determinants of health. And that's often the economic status of people, it's the housing that they experience, it's the safe and fair work that they do every day. These are the things that can often make the biggest impact on people's overall health. It's the influencing some of the harmful health behaviours that they undertake and reducing that when they're harmful, but promoting it when particularly we know it's beneficial, like physical activity as well. And your specific question is, so how do we begin to make sure that we're targeting investment? Well, we use the evidence, because if that's the approach that we've got to take, then we've got to start to identify what are the preventative approaches that actually bring about the biggest impact. And WHO's already produced guides which begin to emphasise what are the useful interventions, but also when you would likely to see an impact made with those. And exercise, physical activity, promotion of physical activity is one that you actually see very early on.
Yeah.
So you see within, some people say 2 years, others 5 years, but certainly within that period, that early period, if you can increase overall the amount of physical activity, which either an individual or a population undertakes, you begin to see the beneficial impacts in their health at a very early stage. You don't have to wait 10 years, 15 years, 20 years, or 3 times, 4 times at the life cycle of a parliament. You can see it within the life cycle of a parliament.
And it's a cheaper investment by far as well. We know walking's been mentioned a lot. I work for Pass for All, Scotland's national walking charity, and it's free. It's a free thing for people to do. Now, some people, those that might benefit from walking most, may need more support to do it. They might need lots of strength and balance stuff to even get moving in the first place. So there are other barriers potentially to some of those people to get to a health walk, for example. But if there are many more health walk options for them connected to places where they live, where they are at, it would be a much better investment in terms of, and a much cheaper investment in terms of that preventative spend.
I think we've got to think about this in maybe 2 to 3 stages, haven't we? Because there's that overall aspect of you improve the levels of activity within a population at all ages, and that's going to have a wide beneficial impact on the population across those ages, and it's going to prevent some of the people within that population from going on to develop illness or disease that they might have. But even for people who already have the NCDs or chronic diseases that we were speaking about, it still has a beneficial impact.
Of course.
Okay. So there's 2 ways of looking at it. It's preventative from developing disease, but once you've developed disease, actually continuing to take or even adopting physical activity still can have a beneficial impact, both in terms of delay in progression of your disease, but also in making sure that you stay as independent and able for as long as possible.
Absolutely. So I think a lot of what our conversations touched on here is about communication and getting the right communication at the right time from the right people. If you're living with long-term health conditions and your healthcare providers are seeing being physically active as a first line for you and your conditions rather than something, it's a nice add-on if you can manage it. Turning that around, I think could go a really, really long way. I want to thank you for your time. I'm going to wrap us up soon. I just wanted to take a little opportunity. We finish with our guests asking them about their own movement for health. So something we're trying to promote is because movement, as you said already, Gregor, it's different for everyone. People get joy from different types of movement. Really, joy is the most important thing for your mental health, social health, and physical health. So the best part of my job is hearing some stories about when movement's really played a pivotal role to someone. So I just wondered if you could finish our conversation off by sharing what your movement for health looks like and how does it help you? You have a busy job, you have a busy life. So what does that look like for you?
Yeah, I mean, movement and physical activity has always been something which has been really important to me. And a little story to finish on. When I was very, very young, primary school age, I was really overweight as a kid, really overweight. In fact, people would have said that, medically I was obese as a kid. And around about the age of 10 or 11, I decided to make some changes to my life. And first of all, I changed my diet, because that's the important part if you want to lose weight, is to change your diet and approach. But I took up physical activity at that point. And I remember getting a second-hand bike at that point and started to cycle. And I've cycled ever since then. And I love cycling. And cycling for me has been probably my favourite form of physical activity over the years. I feel free when I'm on a bike. I feel able to just enjoy it, being outdoors and experiencing that type of movement. And so cycling for me has been part and parcel of my life for many, many years. And every year now I do a charity bike ride with the most wonderful group of people who are all into the same kind of music as I am. And we ride from London to North to one of the big music festivals. And
Nice.
and there's both the physical joy of being on the bike for a few days with them, but also the camaraderie of being in the group as well. So that type of group activity. So that's one form of the way that as I say, it helps me. And I use nowadays, I walk much more than I ever did in the past. I try to use active transport as often as I can. And what I mean by that is actually either parking the car when I have to take further away than normal and walking the distance in between, or using public transport and walking to public transport. So I try and use those type of things much more often these days as well. But maybe my first love now is the gym and resistance training, because there's something about that I found in later life. Now, all of these things put together give me a package, a way of dealing with some of the physical and mental stresses that I experience in my life. And I find that actually one of the things that I turn to when I find life is stressful, when it all begins to kind of feel as though it's, just closing in on you a wee bit, is I exercise. I get movement. And as I say, that could be on a beautiful day like it is today in Glasgow, getting out there and just walking along the Clyde for a little bit and experiencing some fresh air. Or it could be going to the gym tonight and doing something in the gym. But that's how I calibrate and my kind of emotional resilience is through the use of exercise, I think.
I think that's a really lovely thing to share. And I love the word calibrate, and I love the word resilience in there. I think I would share some of that activity, and certainly I go out to clear my head. For me, it's headspace. Can be a noisy place in there. I need to cut through it. And so I can't do that just sat in front of a screen all day long. And we didn't touch on active travel in our chat today, but one of the other themes, looking at active travel in Scotland and how that can support people to move more to benefit. And obviously that climate crisis, part of the piece that you referred to at the beginning, active travel plays such a big part in addressing some of that. Thank you again, Gregor, for your time today. It's been really, really appreciated. I hope you've enjoyed it. And we will see much more of you again in the future, I'm sure. But thank you. And thank you to our listeners for tuning in today. If you've enjoyed this session, talking with our Chief Medical Officer about Scotland's active health and social care, please listen to the other 7 in the series. Thank you, and we'll see you next time. Bye-bye.
Thank you.